Hi, I'm Dr. Van Reken in Reno, Nevada. We have Reno Sparks MedSpa here, and I've had the pleasure of having this lovely lady Esther work for me for over 5 years, and she's a wonderful office assistant. And of course, she's gorgeous too, which doesn't hurt when you're running a med spa. And her lips look really good to me, but she would like a little enhancement. She wants a little bit more volume, and she wants a little bit more definition at the border here. And then she wants me to build her pillars up a little bit. And if you look at her, she has a classic pair of beautiful lips. Now let's pretend for a moment that she's older, that she's 50, 60, 70. She would probably have more of this kind of thing going on. And then I would probably put some extra product in the corners to decrease this kind of creasing on each side, which many women have, and men too as they age. So what we're going to do, she's got a fair amount of volume already. So we're going to give her a little bit here, 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 here. And then that's going to be done through a catheter. This catheter or cannula is 1.5 inches long. It's 27 gauge. You would think it's a needle, but it actually is blunt-ended. It's like my finger. It has a side injection port. In fact, I'll show it to you in a moment. But what I'll do is I'll make a nick over here. Because the catheter or cannula is blunt, I can't put it through the skin. It really won't go through. It'll bend and hang up, just like if I try to put my finger there. So what'll happen is I make a little nick with a needle. Then I can slide the catheter in. It'll be right along the lips. I'll give her a little volume above and below. And then I'll go ahead and switch to a needle, which is sharp. I'll go along the border and put a little in here. And then I'm going to build up her pillars a little bit here for those classic pillars. And she's got a very nice Cupid's bow already, and that will enhance that a little bit too as we do this. So we'll go ahead. We'll start. Could you turn slightly and open your mouth slightly? So on the count of 3, I'm going to nick her slightly like this with the needle. This is the access port. 1, 2, 3. Okay, and you can see a little drop of blood there. That's good because you want to be able to see where it is so that you can stick in the cannula. And here's this cannula I'm talking about. So now I'm ready to access that port. Okay, here we go. Open your mouth, please, Esther. That slides right along. It's in the correct position. And she's got a little bit more volume there. I give her about 0.15. And now I'm going to switch to the lower lip, open. Just relax. That slides right along easily. I know I'm in the right place. So Esther, if you don't mind, sit up and take a look. What do you think so far?
I like it.
Where do you want more?
Maybe just along the lines.
And look right at me. And I think maybe just a little bit there to turn this out on this side, up there. That's a little bit fuller, so we'll put you a little bit there with the needle as well.
Okay.
Okay, so we'll switch to the needle. To get this area fuller, you tend to need to do the injection toward the inside. Can you open a little, Esther? So I'm going to come in kind of on the wet-dry border, more or less, rather than just the outside. Open wide. Stay open for me. And stay open if you would. And often I'll put about 1/10 of a cc in for these correction areas. Open real wide. Takes very little product to do this. And you can see that that's now better defined. And I'm going to define this lower lip just a bit. There is an artery in here. It's important that we not go too deep. And we built that up a little bit. I'm coming to the other side. Now, I can give her more there and build that up more. I think I will. Now, I'm going to have her sit up and we're going to have her see what she thinks of her lips so far. Kind of look up a little to get the light on you. What do you think so far?
They're perfect.
Now I have a little bit more product, but you're happy with the lips.
Yes.
Why don't I put a little bit there and there to just fill this in?
Okay.
All right? Boy, it sure is easy to work on beautiful women, I'm telling you. It's a tough job, but somebody's got to do it. All right. And I like to get the cheek and roll it over. So when I'm going for the pre-jowl sulcus, which is what this area is, I like to roll it over and kind of see where it folds. And then I want to be on the inside of that. You don't want to be on it, you want to be inside of it. Just a little bit of product left here, enough for a little injection there on that side. And you can see that that's kind of evened that out a bit. Once again, and we are done. Now you get to look at your face and tell me what you think.
It's perfect.
What a pretty girl. Okay.
Thank you.
You bet. So this is Dr. Van Reken signing off for Reno Sparks MedSpa. Stay good looking.